over 100,000 American deaths as a result of this pandemic. After introducing that very sobering news, the president then went on to brag about his ratings and how they were higher. More people were watching him on TV than were watching Monday Night Football or The Bachelor. He also went on to attack the medical professionals in New York City on the front lines of the global pandemic. New York is now the global epicenter of the coronavirus crisis. There are more than 66,000 cases in New York, and there have been over 1,200 deaths. Our doctors and nurses and medical professionals are fearlessly risking their lives to treat sick patients, often without the protective gear that they need to take care of themselves. And President Trump took advantage of yesterday's briefing to lodge a smear against them that he did not provide evidence to back up, that it might be doctors and nurses stealing medical supplies that are resulting in the shortages that medical professionals around the country are sounding the alarm on. In addition to attacking medical professionals, he also attacked the governor of Washington State, one of the states with the highest rates of coronavirus cases, and he attacked the governor of Michigan, another state that is particularly feeling the pain of this crisis. And he even, as is often the case, particularly when he's in the Rose Garden, he even went out of his way to insult and belittle Yamiche Alcindor of PBS News, saying that she was not being nice and even suggesting that she was being threatening by asking a question in which she merely quoted verbatim something that he had said before and asked for an update on that. He denied that he'd said it, but he did say it. It's on tape. We're going to take your questions. We're waiting now for the president to come on. And once you post some questions in the comments, our team will do our best to answer them. We are each working from home. We're mostly in New York, the epicenter of the global pandemic. New York has been under a stay-at-home order for over a week now. And so without the benefit of our studio, our team has tirelessly worked to pull this presentation together, and our dedicated producers will be pulling your questions and trying to get answers for you for whatever questions you might have on any subject. The first question that we've gotten is Daniela in New York. She has asked about rumors of a rent freeze in New York City. And there seem to be rumors of more than is actually happening. But here's what I can tell you. The state of New York has put a 90-day moratorium in place on evictions for non-payment of rent. So if you find yourself unable to pay rent, your landlord cannot evict you for the next 90 days. On top of that, your landlord can also not charge additional fees. Now, at the end of the 90 days, or at least unless this gets extended, at the end of the 90 days, you will ultimately need to pay the back rent, but you can't be charged any penalties on top of that. Additionally, Mayor de Blasio is working to try to put a stop to any rent increases on rent-stabilized apartments in New York. So those are items that are in the work. We have a question from Kat asking, will Florida go on to a lockdown? And Zara Heder in our newsroom is going to pull an answer for that. But I can tell you that the governor of Florida has been very resistant to impose the types of safeguards that virtually all public health officials are asking for. Governor Ron DeSantis refused to close down the beaches, encouraged spring break to move forward as planned. We have seen data showing that people who came to New York got exposed to other people who might be carrying the coronavirus and then went back to states all across the country. So Florida's spring break has caused a real risk to the whole nation by proceeding without any health safeguards. Governor DeSantis has tried to blame New York for Florida's problems, tried to claim that the problem is that New York is bringing the coronavirus into the state, but it does seem to be the governor who is inciting the ire of people wishing that he would take a more cautious approach. The Miami Herald has specifically called him out. Seeing if I can pull up the phrase that they used. Well, the Miami Herald editorial board has specifically condemned Governor DeSantis for refusing to close the beaches or issue more stringent stay-at-home orders like so many parts of the country have in place. Today, Virginia laid down a stay-at-home order until June 10th. Virginia's governor is a doctor, so one would expect him to be leading with science as opposed to wishful thinking. Now, we're going to see if we can answer any other questions that you have. Please type them into the comments. We have a little bit more information for Kat on Florida. While Governor DeSantis has refrained from putting a stay-at-home order in place for the entire state, many local jurisdictions have restrictions in effect or going into effect, and these include Broward County, Gadsden County, and many others. Public health officials say statewide lockdowns implemented early and aggressively are necessary to curb the coronavirus pandemic. I saw a very wise tweet the other day, and I apologize to the person who tweeted it because I've forgotten who originated it, but someone said that the pattern that we keep seeing is that in places like Italy and now New York, places with high incidence of this virus, everyone says we wish we had taken action sooner. If only we had taken action sooner. And in the areas that don't yet have an outbreak, what we're hearing said there is, well, we don't need to do anything because it's not here. It would be encouraging if those areas that are not yet experiencing this crisis to the full extent could learn from those states that have gone before. Governor Cuomo has tried to warn the rest of the nation that New York is not an outlier. New York is the future for the rest of the nation. New York now has more cases than any other place in the world. As I said, it was over 66,000 cases at the time that I last checked. This is partly because of how closely New Yorkers live with each other. It creates ideal situations for the spread of the disease. It is partly because New York is a place that brings people in from all around the world. But the high number is also due to the fact that New York is testing more aggressively than any other place in the nation. Roughly 25% of all the tests being conducted in America are being conducted here in New York. So it's not just that New York has more cases, it's that New York is more accurately identifying those cases. And as other states step up their testing, we may find that they have much higher rates of cases than we think. Now we have some more questions. Misty asks, what are PPEs? That's a good question. You hear that jargon being used all the time. PPE just stands for personal protective equipment. This is the sort of things that healthcare workers have to keep themselves safe and to keep themselves from spreading virus to other people. So these include, PPEs include the masks that medical professionals wear, the gowns, the gloves, the booties that they put over their shoes. Those are all part of what we're talking about when we talk about PPEs. Now, a nationwide survey by the by the U.S. Conference of Mayors found that roughly 92% of the cities in this country say that they do not have an adequate supply of this personal protective equipment. And numerous mayors, governors, public health officials have been calling on President Trump to more fully take advantage of the Defense Production Act. So far, he has used it only to compel GM to begin producing ventilators. But as Governor Cuomo has pointed out, any company that makes apparel could be making masks, could be making surgical gowns, could be making the personal protective equipment that our first-line responders are begging and pleading for. Now, we have another question. This is from Christy. How long can COVID-19 remain on surfaces? This is something that we are continuing to learn about. According to the most recent information from the CDC, the coronavirus can live up to 24 hours on porous surfaces like cardboard, paper, and fabrics. But it can live up to 72 hours on harder surfaces like glass, countertops, stainless steel, or plastic. And this is, it might be counterintuitive. You might imagine that it would not live as long on your hard
Ladies and gentlemen, the President of the United States and the Vice President of the United States.
Here comes the President of the United States. I'm going to get quiet for a minute so that he can start talking, but as he says things, I'll be continually checking in with you with the support of our newsroom to let you know if they're factual.
Very comfortable here, a lot of room, and we appreciate you being here. Yesterday I announced that we would be extending our social distance guidelines through the end of April. This is based on modeling that shows the peak in fatalities will not arrive for another 2 weeks. The same modeling also shows that by very vigorously following these guidelines, we could save more than 1 million American lives. Think of that, 1 million American lives. Our future is in our own hands, and the choices and sacrifices we make will determine the fate of this virus and really the fate of our victory. We will have a great victory. We have no other choice. Every one of us has a role to play in winning this war. Every citizen, family, and business can make the difference in stopping the virus. This is our shared patriotic duty. Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line, this 30 days. So important because we have to get back. But the more we dedicate ourselves today, the more quickly we will emerge on the other side of the crisis. And that's the time we're waiting for. The more we commit ourselves now, the sooner we can win the fight and return to our lives. And they will be great lives, maybe better than ever. Today we reached a historic milestone in our war against the coronavirus. Over 1 million Americans have now been tested, more than any other country by far, not even close, and tested accurately. And I think what I'd like to do is ask Secretary Azar, who's done a fantastic job, to come up and just say a few words about the fact that we reached substantially now more than 1 million tests. Please. Thank you, Alex.
Now, I have to call attention to already something misleading that the president is saying. He is saying that we are doing more tests than any other country. That is technically true at the moment. We are conducting a larger raw number of tests, but we are far behind most other countries on testing per capita. And it is the failure to quickly begin testing that has largely gotten us into this situation. South Korea and the United States had their first confirmed case of the coronavirus on the exact same day, January 2nd. South Korea immediately implemented widespread testing within the first 2 weeks of the first case. It took a month before the U.S. had a systematic plan to begin testing, and it has only been within the past week and a half that widespread testing has been occurring in the U.S.
Of the private sector and our state and local leaders, the centerpieces of America's historic approach to testing. I want to thank those state and local leaders who've used their on-the-ground resources and knowledge to lead testing and make it much more easily accessible to the Americans who need it. I'm also grateful to FEMA, with whom we're now working closely to get state and local partners what they need. I also want to thank CMS, where Administrator Verma has given healthcare providers unprecedented flexibility to scale up capacity for testing and treatment and has ensured that tests will be paid for. Finally, we would not be where we are today without the many American companies, entrepreneurs, and scientists who have worked day and night to develop, as of today, 20 different emergency testing options. With the FDA responding to requests for authorization typically within 24 hours, the number of options is growing nearly every day. FDA has also opened up new options for using the available tests, like self-swabbing, and new options for reagents. I also want to thank FDA and other components of HHS for incredibly rapid action on other tools that we need. This weekend, we actually worked to secure 30 million tablets from Sandoz and 1 million tablets from Bayer of hydroxychloroquine and chloroquine, which are potential COVID-19 treatments, and we authorized Battelle's new decontamination machines, which can each sterilize thousands of essential N95 masks for reuse every day. So thank you, Mr. President, for your leadership, and thank you to everybody who's played a part in getting us where we are today. Thank you.
Thank you very much. Thank you. I'd like to ask Dr. Hahn to come up, FDA, because we have some really good stuff. First of all, the numbers have been incredible on testing, but in the days ahead, we're going to go even faster, and we have something from Abbott Labs, which is right here, and that's a 5-minute test, highly accurate. And I maybe can show that as we listen to our FDA commissioner, the job he's done, and the approval process. We talked about the chloroquine and the hydroxychloroquine just now. I thought that I'd mention it, but Alex has already done that, but we have that now under test with 1,100 people in New York, and it was only the fast approval by FDA that allowed us to do that. It was a really rapid approval. And Doctor, please say a few words, and this is the first one on the line of the 5-minute test from Abbott.
Thank you, Mr. President, for your leadership. Thank you, Mr. Vice President, for your leadership of the task force. I'm very proud of...
The President keeps hyping the potential use of chloroquine and hydroxychloroquine as treatments for the coronavirus. It's important to note that they are unproven. There is not conclusive research suggesting that they help, and one needs to be very careful about self-medicating. Already there is a couple in Arizona who, saying that they were inspired by statements made by the President, tried drinking fish tank cleaner that they believed contained this chemical, and one of them died as a result of it.
Minutes of having this test done. Now, with those tests being approved for Abbott and for others, these are available around the country. They're planning to scale up the number of tests that can be put out throughout the country over the next month, and patients can get the answer within as little as 15 to 5 minutes. And then, of course, an appropriate plan of treatment can be given. We at FDA are working quickly with Abbott as well on other testing approaches, and normally these tests take months to develop. I was on the phone today with the Abbott CEO. He told me that normally this is a 9 to 12-month approach to developing a point-of-care test. They did this in collaboration with FDA and U.S. government within weeks. Abbott has shared that they will be delivering these tests tomorrow, and then we'll be ramping up. Just like to emphasize one thing: the most innovative and safe products come from the private sector in partnership with government, taking an all-hands-on-deck approach, just like in this case. And the other point here is that Abbott and FDA worked together to make sure that we had a fast, reliable, and accurate test to market. Thank you.
On the subject of testing, I also want to point out that numerous states are reporting not only a shortage of tests, but a shortage of the necessary materials to conduct the tests. For instance, even states with small populations like Wyoming's have found that they don't have enough swabs to conduct the tests. And in Florida, Governor Ron DeSantis said that the state had the capacity to administer 625,000 tests, but didn't have the swabs and other necessary supplies to conduct those tests. They had only roughly 30,000 people tested because of a lack of those materials.
So the private sector, as you'd say, Steve, it's been amazing what's happened, really amazing. And we're going to introduce you to some of the greatest business executives in the world today, no matter where you go. And they're going to say a little bit about what they're doing. And then we have so many more. The FDA has also authorized the Batil's N95 respirator mask sterilization kits. It's an incredible thing. I've been asking, why are we throwing these masks away? You look at some of these masks and they're significant pieces of equipment, and I say, how come you throw them away? Why aren't they using sterilization techniques? And I got a call from Mike DeWine, the governor of Ohio, and he's a tremendous guy, tremendous governor, and he said, we have a company named Batil, and they're having a hard time getting approval from the FDA, and I called up Dr. Hahn, and within a very short period of time, they got the approval. Steve, we really appreciate it. I want to thank Mike, and I want to thank Steve, and
So the president is celebrating the fact that there is a new technique for sterilizing masks so that they can be reused. And while this is good news, it's important to note that this is basically just a workaround for the problem that we do not have enough masks. These masks were designed for single use, and because we do not have enough of them, even though states have been asking for them, we're having to try to find ways to reuse masks that were designed to be used only once.
It's going to make a tremendous difference on the masks. This morning I spoke to our nation's governors to help each state get the medical supplies they need. And yesterday, Vice President Mike Pence asked our nation's hospitals to begin reporting total bed capacity, ICU bed capacity, ventilator capacity, and vital medical supply levels on a daily basis. And Mike, thank you for the great job. Thank you very much. In New York, the 2,900 bed hospital under construction, which is now completed, they completed it in 3 days, you might say 3.5 days, at the Javits Center, will be completed today. And when you look, so they're going up, I think we're going to be adding some more beds, which will be completed today. And we've opened up, whoops, there goes our box. And my hair's blowing around, and it's mine. The one thing you can't get away with, if it's not yours, you got a problem if you're president. And nearly 3,000 medical beds will become operational. The U.S. Navy ship Comfort also arrived.
And the president is correct that nearly 3,000 new beds have become available to New York, but New York is saying that it will need 140,000 beds by the time this crisis reaches its apex in New York.
Pretty amazing what they've done. The Army Corps of Engineers, what they've done, they just completed, think of it, a 2,900 bed hospital in New York in just about 3 days, maybe 4 days. And the whole city's talking about it. On top of that, we floated in a great ship, which is going to be 1,000 rooms, which is being used for patients outside of what we're focused on, and that will free up a lot of rooms for what we're focused on. So it's been great. The Army Corps of Engineers has awarded contracts for the construction of alternate care facilities also at the State University at Stony Brook, State University Old Westbury, and the Westchester Community Center. We're sending 60 ambulances to New York City today. We have a total of 60. We're getting some additional ones with up to 190 more to follow at different locations. To date, FEMA has obligated more than $1.3 billion in federal support to the state of New York. So we're spending a lot of money in New York. It's a hotbed. There's no question about it. And we're spending a lot of time, effort on New York, New Jersey. Spoke with Governor Cuomo a lot.
Now, the president is highlighting spending over $1 billion in New York, but Governor Cuomo has said that this is a reckless and irresponsibly low amount of money to be spending, and that the city is facing a direct shortfall of $15 billion as a result of this crisis.
The 8,100 ventilators that we've already delivered over the next 48 hours, we're delivering $150 ventilators to Illinois, 150 to Louisiana, and 50 to Connecticut. FEMA and HHS already delivered 11.6 million N95 respirators, 26 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, and 22 million gloves. And I don't know if you just saw, it just came over the wires that Ford just announced just a little while ago that they will produce, along with General Electric Healthcare, 50,000 ventilators, and they're going to be doing it in less than 100 days.
Now, the president is highlighting what he has sent to states, and he specifically named Illinois, but Governor J.B. Pritzker of Illinois has said that they have received, quote, only a fraction of what we've asked for, and also reported that when he requested the N95 masks, what he got instead were 300,000 surgical masks, which is not what was requested.
As we can. But the fact that we're doing so many so quickly is a tribute to our great companies. More than 14,000 National Guard members have been activated and can help supplement state and local efforts to distribute personal protective equipment, where we're sending a lot. We have plane loads coming in. We have 51 loads from various locations all around the world, and they're landing. We had our first big cargo plane land this morning, and we're getting it from all over the world, and we're also sending things that we don't need to other parts. I just spoke to the Prime Minister of Italy, and we have additional capacity. We have additional product that we don't need. We're going to be sending approximately $100 million worth of things, of surgical and medical and hospital things to Italy. And Giuseppe was very, very happy. I will tell you that they're having a very hard time. Joining us this afternoon are CEOs of the great American companies that are fulfilling their patriotic duty by producing or donating medical equipment to help meet our most urgent needs. What they're doing is incredible. And these are great companies. Darius Domchek of Honeywell, you know that. And Darius has been somebody that I've dealt with in the past, and he's a great leader of a great company. Deborah Waller of Jockey International. A friend of mine, Mike Lindell of My Pillow. Boy, do you sell those pillows? That's unbelievable what you do. David Taylor of Procter & Gamble, and Greg Hayes of United Technologies Corporation. And I just want to tell all of you that America is very grateful to you and what you've done. Amazing job you've done, and we thank you very much. I'd like you to come up and say a couple of words, if you might, about your companies. Mike, come on up. Come on up, fellas, please. Come on up. You have to say what you're doing because it's been really incredible. Go ahead, Mike.
Okay, well, My Pillow is a U.S. vertically integrated company which has been forced to adjust to the changing business environment as a result of the pandemic. My Pillow is uniquely positioned as a U.S. company that functions as a manufacturer, logistics management distributor, and direct-to-consumer. Given our current business lines, we are experiencing the effects of this pandemic firsthand. What My Pillow has done, we've established an internal task force which is monitoring future needs of companies across the country as a result of this pandemic, and given our position, we've begun to research and develop new protocols to address the current and future needs of U.S. businesses across multiple sectors.
Just a little bit more info about this company, MyPillow. They have been ordered to pay a $1 million civil penalty for false and misleading claims, specifically about the health effects of their products. The company has falsely claimed that the pillow could cure not only insomnia, but also sleep apnea, fibromyalgia, and even multiple sclerosis. These are not true claims, and as a result, MyPillow was ordered to pay $1 million in penalties.
The United States, and I'm even more proud to be able to serve our nation in this great time of need. Thank you, Mr. President, for your call to action, which has empowered companies like MyPillow to help our nation win this invisible war. Now I wrote something off the cuff, if I can read this. Okay. God gave us grace on November 8, 2016, to change the course we were on. God had been taken out of our schools and lives. A nation had turned its back on God. And I encourage you to use this time at home to get back in the Word, read our Bibles, and spend time with our families. Our president gave us so much hope where just a few short months ago, we had the best economy, the lowest unemployment, and wages going up. It was amazing. With our great president, vice president, and this administration, and all the great people in this country praying daily, we will get through this and get back to a place that's stronger and safer than ever.
Now, he's also made the claim again, a claim that Trump often makes, that the economy was stronger until this happened than ever in history. That's a claim that Donald Trump has made frequently. It is not true. While the economy was strong on many metrics, more jobs were created in the last 3 years of Obama than in the first 3 years of Trump. GDP growth was consistently lower than Donald Trump had promised. He promised it would always be over 4%, and it's averaged about 2.5%. The stock market grew at faster paces at different times, both under Obama and Clinton, and real wages have actually declined, adjusted for inflation, over the past few years.
To serve the healthcare worker. A few days ago, we announced the startup of a new manufacturing facility in Rhode Island. We're going to be hiring 500 employees. We have already 200 on board, and we're going to be starting the production of N95 masks within the next 2 weeks. Furthermore, today we're announcing the startup of another manufacturing facility in Arizona. We're going to be hiring another 500 people, and we're going to be starting up production in that facility by the middle of May. So in total, we've doubled our production of N95 masks already. It's going to double again within the next 60 days, and then within the next 90 days, we're going to have 5x the capacity we do today.
Now, as companies volunteer to create these needed supplies, that is good news, but the president has the power to compel and to coordinate all industries that could be involved in this to doing it. It is not necessary to rely upon these voluntary efforts.
Thank you. Normally I'd shake his hand, but we're not supposed to do that anymore. So that's okay. Great job. Thank you to Honeywell. Please go ahead. Step up the stage.
Thank you, Mr. President and Ms. Vice President, on your guidance during this unprecedented time. And I'm very honored to be here today. Founded by a minister 144 years ago, Jockey International is a family-owned company headquartered in Kenosha, Wisconsin. Since 1876, we have been providing socks and underwear for generations of families. It is part of our DNA to roll up our sleeves and help our country in her time of need. During World War II, we made parachutes for the military. And today we are eager to serve this great country by providing support for the healthcare workers on the front lines of this fight. As the President and Vice President have said, it's a whole of America approach, and we are committed. Jockey has had a long...
I believe she just said that Jockey created parachutes during World War II, and this is the perfect example. In World War II, all industries were called upon to produce the items needed for the war effort. It was not merely done on a voluntary basis. And the President could be enacting this now.
To be production ready. As a result, we expect to begin delivering 30 to 50,000 units of scrubs to the frontline doctors and nurses at the Javits Convention Center in New York City. We would not have been able to do this without the collaboration of the administration, representatives from the federal agencies, and Congressman Brian Stiles. Thank you very much, Mr. President and Mr. Vice President.
Thank you very much.
Thank you, Mr. President, Mr. Vice President, for bringing us together today. I'm proud to be able to represent the men and women of Procter & Gamble who every day, 24 hours a day, are working to build and make essential cleaning products, hygiene products, and healthcare products for families everywhere. These include healthcare workers and for institutions that are serving those on the front line. P&G people are the faces of brands you know and trust. Brands like Tide, Pampers, Bounty, Charmin, Mr. Clean, and Vicks. In addition to making, packing, and shipping these essential items, they've worked together to transform our plants, to make things we've never made before, like hand sanitizers and facial masks. Some of these are already getting to national, state, and local agencies. Some of them are in the hospitals already. Everywhere around the world, P&G people are working every day to serve everybody, consumers, and they're working together to bring together the full capability of our research and development, our engineering, our manufacturing, and our communications capability to make sure we make a difference to the consumers we serve and to all the audience that we can make a difference to. I want to thank them, and I'm very grateful for what they do every day in service to others. Thank you, Mr. President, Mr. Vice President, for bringing us together today.
Thank you. Mr. Procter. Thank you.
Good afternoon. I'm Greg Hayes from United Technologies. And on behalf of the 240,000 employees of United Technologies and the 70,000 employees at Raytheon, which will join together with UTC this Friday, I want to first of all say thank you to the President and the Vice President for your leadership during what is really a war. It is a different war than anybody has ever fought before, but it's a war that we're uniquely qualified to help. As one of the world's largest defense contractors and some of the best technology, we're using that technology to try and solve some real-world problems. Today we're working with the Air Force to try and help pilots as they're moving medical evacuees with the COVID-19 virus such that they can be protected and that the patients can be protected. Again, we're working also with logistics, and if you think about a war, strategy is important, but logistics wins war. It's imperative, I think, with FEMA, along with Mr. Navarro's office, that we coordinate all of these activities. Last week we donated about 90,000 pieces of personal protective equipment to FEMA. Next week we'll have another almost 1 million. Again, working through our supply chain partners around the world. We're also today, this week, beginning the manufacture of face shields. Using the additive technologies that we have and the machines that we have available within UTC, we'll be able to produce approximately 10,000 shields in the next 4 weeks. Again, all needed equipment. We stand ready to help in any way we can. We don't need the Defense Production Act to ask us to act. All of the people at UTC and Raytheon are focused on this war and winning it. Again, I also want to say thank you to all of our employees for their work during this crisis, as well as to the frontline medical and other first responders. Thank you very much.
Thank you very much. Thank you. Fantastic. Great company. Those are great companies. Thank you very much. I'd like to ask Seema to come up and say a few words about what you're doing and what's happening and how positive it's been. I really appreciate it. Come on up, Seema. Irma.
Thank you, Mr. President. And let me start by saying I want to convey my deepest sympathies to those that have lost loved ones to the coronavirus. We're all thinking of you. Today is Doctors' Day, and even without it, I want to send a message of gratitude to the foot soldiers in this war, men and women that are providing care and comfort to Americans that have been affected by the virus. Your country is grateful. And in short, as the President has said, we are engaged in a war against an invisible enemy. In wartime, the assumptions of peacetime must be revisited.
I do want to say that while this very appropriate shout out is being given to the men and women on the front lines of this fight, yesterday President Trump used the briefing to suggest that they were thieves, that New York's doctors and nurses were stealing the protective gear, and that was why there was a shortage of it.
Patient care. And there are several components to our announcement today, but the first one is CMS's Hospitals Without Walls. And this is going to allow hospital systems to create new treatment sites outside of their facility to expand capacity and be able to safely separate patients that are infected with the coronavirus and those that are not. Now, FEMA is doing incredible work setting up temporary hospitals in New York and other areas. But under these waivers, we are empowering local communities to complement and augment the work of FEMA and allowing hospital systems to tap into the capacity that already exists in their communities, making use of dorms and hotels or gymnasiums, and allowing the main hospital to focus on those that need the most intensive care. There are surgery centers out there today that are delaying elective surgeries, and they may have excess capacity that could be devoted to hospital-like care. We are also making changes to the Medicare program to facilitate testing. So some people that need a coronavirus test can't leave their home, or patients that are in a nursing home. And now we will pay for labs to go out to these locations and perform testing. And we're also expanding the workforce. We are taking action today to relax some of our regulations to allow hospitals to increase their workforce. And we're allowing a broad range of flexibilities so that we can let healthcare workers operate at the top of their license. And we are also allowing our hospitals to provide more support for our healthcare workers. Under today's regulations, they can only provide minimal support to healthcare workers, but now we're going to allow them to provide child care, meals, laundry services. And then there's also telehealth. The President already directed a dramatic expansion of telehealth to our nation's 62 million seniors with Medicare, and we're so proud of all the healthcare providers and patients that have rapidly implemented telehealth. But today we're announcing that we're going to go even further, and we're going to be paying for doctors to make phone calls with their patients and provide care over the phone. And we're getting rid of long-standing barriers to telehealth in the Medicare program, allowing emergency rooms to use telehealth and eliminating requirements that some visits be provided face-to-face. And I also want to mention that on Saturday, the President directed CMS to offer advance payments for healthcare providers that are experiencing cash flow problems. We know that many providers are complying with our recommendations to delay non-essential elective surgeries, and they shouldn't be penalized for doing the right thing.
Now, I just want to interrupt Administrator Verma briefly. She is the administrator of the Center for Medicare and Medicaid Services. President Trump and his administration are still involved in a lawsuit to overturn Obamacare, which would undo the Medicaid expansion and remove the service from many people who rely upon it.
Will have the flexibility that they need to confront the needs of the coronavirus pandemic. And there are many heroes in this war, but I want to take an opportunity to thank the team at CMS. These folks have worked day and night. The flexibilities that are in this regulation, and any regulation, usually take CMS a year, but we did this in 2 weeks, and I couldn't be more honored and privileged to serve alongside these dedicated public servants. Thank you.
Thank you very much. You did a fantastic job, and you're doing a great job. So we are in the midst of something that is very difficult, but we are going to win. It's just a question of when. We want to do it as quickly as possible. We want to have as few deaths as possible. And we will meet again tomorrow for some statistics and some updates as to where we are, where we think we're going, and timing. I think timing is going to be very important because we have to get our country back. We have to get our country back to where it was and maybe beyond where it was, because we've learned so much. But we will have lost a lot of people, and in many ways they're heroes. And if you look at what's happening with our medical professionals, it's a danger. They're warriors. Men and women are doing a job that the likes of which I don't think anyone's ever seen.
Now, the president is today calling the men and women on the front lines of this fight warriors and heroes. Yesterday, he called them thieves, suggesting that New York's shortages of PPEs were due to, he said, perhaps they're going out the back door.
He's unconscious in a coma. And you say, how did that happen? So I just want to thank all of the great professionals, men and women, doctors and nurses and paramedics and first responders and law enforcement, by the way. If you look at New York and you see how the effect that this had on law enforcement, it's been incredible. These are great people. Firefighters, great people. They're helping in so many different ways, so thank you very much. And if you'd like, we'll take a few questions. John, please.
Thank you, Mr. President. Yesterday, you said that you would be extending the guidelines through the end of April and that you'd be giving us specifics tomorrow. Do you expect that the guidelines will just carry on the guidelines that have been in place now for 15 days? Could there potentially be some modification? Also, you have some travel restrictions that come up for reconsideration. Yeah. The one from the EU on April 13th, Canada, U.S., Mexico border on April the 21st. What will happen with all of that?
They'll be staying, and we may add a few more, but the guidelines will be very much as they are, maybe even toughened up a little bit. But they're having a big impact. They're having a tremendous impact, and we're starting to see it. And that's the key. We're starting to see the impact that they're having.
And if I could ask you to, you talked about Ford now ramping up production of ventilators. The government is sending thousands of ventilators across the country. Clearly the supply is increasing, but when you look at the production curve against the hospitalization curve, can you guarantee that everyone who needs a ventilator in the next few weeks will be able to get one?
Well, I think that some are ramping up to a level that they're not going to have to, John, and I think that we also have kept in reserve. We have almost 10,000 ventilators in our line. We have them. We've held back just because we did the stockpile. We didn't want to give them because we don't know where the emergency. It hits like so fast. It comes so quickly, and we have 10,000. We're probably going to send some of them now. We've been sending a lot to Michigan and various other states. We'll probably send some additional ones to Michigan. New York's been doing very well, but we can add some more to New York. We're adding them to the areas that are having a problem. Even Alabama all of a sudden flared up a little bit.
Now, the president is giving a rosy picture of how many ventilators will be provided. A recent survey of the U.S. Conference of Mayors found that our nation's cities are short roughly 140,000 ventilators. He highlighted the number of ventilators that are being sent to New York. I believe the latest number is that 4,000 were being sent to New York, but the governor of New York has said that 30,000 are needed. The president has repeatedly questioned that number and expressed doubt at it. The governor of Louisiana said this weekend that he can only get 192 ventilators when he is seeking 12,000. And so the universal response seems to be that governors are saying they are not getting the ventilators they need to be prepared for this crisis.
A really good call, and that was randomly selected, largely Democrats and Republicans, and they're I think for the most part they were saying thank you for doing a great job, and we discussed that at the end of the call. So it really, people are very happy with what we're doing. Now the circumstances are so terrible because of what's going on, but I think they're very impressed by the federal government. I watched that beautiful ship floating in today into, weeks ahead of schedule, almost 4 weeks ahead of schedule into New York Harbor, Comfort, and I watched the Mercy floating in to Los Angeles almost a week ago. And they are stocked. They are really ready to go. They're stocked with both talent and tremendous amounts of equipment. And the Navy and everybody else involved, they got it ready so fast. It's just incredible what they can do. They've geared up. That's why, I am so impressed by the people involved. Mike and I were talking about it before, the level of genius to put it all together so quickly. This wasn't a month ago. Nobody ever heard of this. Nobody had any idea. The Mercy was being maintained. It was in.
The president just said a month ago nobody had ever heard of this. Now, the president was warned in January about this pending crisis, and it is true that the ships have been put together much faster than had been expected, but the process did not begin until long after we had warning signs that a crisis was developing.
Was impressed by what we've been doing with Gavin in California and Los Angeles area in particular, but really San Francisco, all over California. When you look at what we're doing with Michigan, we're getting along very well with Michigan. It's a great place. We're sending a lot of things to Michigan because that's becoming a hotbed, especially a specific area, as you know. It's become very hot. It's become, I don't know, could even at some point supersede, but it's got to be taken care of. So.
And the president just said that we're getting along very well with Michigan. He had seemed to say the other day that Michigan should not receive federal aid if the governor, Gretchen Whitmer, does not show enough appreciation. And on Friday, he said that he advised Mike Pence, don't call the governor of Washington. You're wasting your time with him. Don't call the woman in Michigan.
And originally they were approving it for 10,000 masks, and then it was supposed to be for 80, and they ultimately approved it for 120,000. It's a tremendous number. And I kept wondering, why are they sterilizing these masks? I assume maybe you couldn't do it. But then I'd look at them, and they'd look like, it's not cloth. It's something that looks like it could be sterilized, and that's what they've done. And that's the machine that is over there, actually. They have a piece of the machine over there. I won't bother showing it to you. And this is incredible when you talk about 5 minutes, 15 minutes, and highly accurate, and not nearly as disturbing to do as the other tests. So we've just gotten better. We're doing things that nobody else ever thought of. Please.
The president keeps using phrases like nobody ever thought of this. I can't stress enough that U.S. intelligence agencies were issuing ominous classified warnings in January and February about the global danger posed by the coronavirus at the very time that President Trump and Republican lawmakers were publicly downplaying the threat. And this is an exact quote from the Director of National Intelligence Worldwide Threat Assessment from an entire year ago, from January 2019. We assess that the United States and the world will remain vulnerable to the next flu pandemic or large-scale outbreak of contagious diseases that could lead to massive rates of death and disability, severely affect the world economy, strain international resources, and increase calls on the United States for support. President Obama had put in place in the National Security Council a specific task force called the Global Health Security Unit. President Trump fired this team in 2018. Earlier this year, he said that he did it for cost-saving reasons, and now he is saying that no one could have known about this before, when he, in fact, dismantled the team that would have been at the forefront of alerting him and the U.S. as a whole about this danger.
Abortions, and should more states be doing the same?
Well, I think what we're doing is we're trying to, as a group, governors, and that's Republicans and Democrats, we're just working together to solve this problem. That's been what you're mentioning has been going on for a long time, and it's a sad event, a lot of sad events in this country. But what we're doing is now we're working on the virus, we're working on that hidden enemy, and I think we're doing a great job on, as good a job as you could possibly do. When Tony and Deborah came up with numbers yesterday to say that if we did nothing, you could lose 2.2, up to 2 point, maybe beyond, I don't know, maybe beyond, but 2.2 million people if we did nothing. And I can't tell you what the unfortunate final toll is going to be, but it's going to be a very small fraction of that. So we're doing an awfully good job, I think, with what we're doing. Please, go ahead.
Ohio?
Please.
Are you considering at all a nationwide stay-at-home order? I know there's a lot of states that have put them in place, but some haven't. I'm just wondering if you were considering some sort of broad stay-at-home order. And then I have a question for Dr. Birx, too, if you don't mind.
Well, we've talked about it. We, there are some parts of the country that are in far deeper trouble than others. There are other parts that, frankly, are not in trouble at all. So hopefully we're going to be able to keep it that way by doing what we're doing. So we talk.
Now, the president is saying that parts of the country that are not impacted don't have a problem. He has said this in the past about states like West Virginia. West Virginia, at the time that he praised West Virginia for having no cases of the coronavirus, had no testing taking place. And many of these states that appear to have low amounts of coronavirus may actually have a much higher rate than we know because testing has been so insufficient.
This country have done an incredible job. If we do that, we will let you know, but it's pretty unlikely, I would think, at this time.
Can I ask a quick question for Dr. Birx
Yes.
also? So Dr. Birx, if you don't mind, you had mentioned today that this model that predicts 100,000 deaths is if we do things almost perfectly. So I wanted to know, are we currently doing things almost perfectly, or are there more things we need to be doing to cap, to not exceed that 100,000, 200,000 model?
Please, come.
While Dr. Birx is coming up, all right, well, she's here. I'll get back to this point.
The graphs and all the information that we took to the president for the decision. But and I just want to thank the data team that's working day and night to get, I usually get my data about 2 a.m. from them, and they assimilate all the data from all the states. And when you look at all of the states together, all of them are moving in exactly the same curves. And so that's why we really believe this needs to be federal guidance, so that every state understands that it may look like 2 cases today that become 20, that become 200, that become 2,000. And that's what we're trying to prevent. And I think states still have that opportunity, but they're going to have to do all of these these recommendations are recommendations that the globe is using. And so we really do recommend that every governor, every mayor looks very carefully and ensures that their communities are utilizing these guidance.
Thank you very much. Thanks. It is amazing. You look at Louisiana, and for a long time it was just staying at nothing. And then all of a sudden, I look one day and I see a lot and a lot and a lot, and then it explodes. And
Louisiana's rate was staying at nothing during the time when it was not testing people. Then when testing began to occur, we saw the confirmed cases.
Cyclical virus. So, and maybe both of you could comment on this, and Dr. Birx as well. Are you prepared for this to strike again, say, in the fall? All the efforts that are taking place right now to contain this, to be proactive, and
yeah. We're prepared. I hope it doesn't happen. Doctor, would you like to say something about that? I hope it doesn't happen, but we're certainly prepared.
In fact, I would anticipate that would actually happen because of the degree of transmissibility. However, if you come back in the fall, it will be a totally different ballgame of what happened when we first got hit with it in the beginning of this year. There will be several things that will be different. Our ability to go out and be able to test, identify, isolate, and contact trace will be orders of magnitude better than what it was just a couple of months ago. In addition, we have a number of clinical trials that are looking at a variety of therapeutic interventions. We hope one or more of them will be available. And importantly, as I mentioned to you many times at these briefings, is that we have a vaccine that's on track and multiple other candidates. So I would anticipate that, a year to a year and a half, we'd be able to do it under an emergency use. If we start seeing an efficacy signal, we may be able to even use a vaccine at the next season. So things are going to be very, very different. What we're going through now is going to be more than just lessons learned. It's going to be things that we have available to us that we did not have before.
Okay, please, go ahead.
Thank you. Scott Gottlieb, your former FDA commissioner, wrote a roadmap for recovery after the coronavirus.
Very interesting. I saw it.
He suggests, the roadmap suggests that everybody wear a mask in public. Is that something that the task force thinks is a good idea?
Well, we haven't discussed it to that extent, but it's certainly something we could discuss. We're getting certainly the number of masks that you need. we are in the process of talking about things. I saw his suggestion on that, so we'll take a look at it for a period of time, not forever. I mean, you know, we want our country back. We're not going to be wearing masks forever, but it could be for a short period of time. After we get back into gear, I could see something like that happening for a period of time, but I would hope it would be a very limited period of time. Doctors,
the president is addressing the possibility that all Americans might be called upon to wear masks. At the moment, there are not enough masks for our medical professionals, and he has been saying repeatedly that we are prepared, but across the U.S., hospitals are facing shortages of masks, of protective gear, and of life-saving ventilators.
If you get too close to somebody, that's pretty severe. But he's somebody. He was with me for a long time. They did a great job at FDA. So we're taking a look. I just received it a little while ago. He sent it over. So very good. Go ahead. Let's give it a shot.
What do you say to Americans who are upset with you over the way you downplayed this crisis over the last couple of months? We have it very much under control in this country. The coronavirus is very much under control in the USA. It's going to disappear. It's like a miracle. It will disappear. March 4th, we have a very small number of people in this country infected. March 10th, we're prepared. We're doing a great job with it. It will go away. Just stay calm. It will go away. What do you say to Americans who believe that you got this wrong?
And I do want them to stay calm. And we are doing a great job. If you look at those individual statements, they're all true. Stay calm. It will go away. You know it is going away, and it will go away, and we're going to have a great victory. And it's people like you and CNN that say things like that. It's why people just don't want to listen to CNN anymore. You could ask a normal question. The statements I made are, I want to keep the country calm. I don't want panic in the country. I could cause panic much better than even you. I could do much. I would make you look like a minor league player. But you know what? I don't want to do that. I want to have our country be calm and strong and fight and win. And it will go away. And it is incredible, the job that all of these people are doing, putting them all together, the job that they're doing. I am very proud of the job they're doing, that Mike Pence is doing, that the task force has done, that Honeywell and Procter & Gamble and Mike and all of these people have done.
Now, the president is seeming to claim that he was not downplaying the impact of the virus in the past, but over and over again he has. Even just a few days ago in an interview with Fox News, he again compared the coronavirus to the seasonal flu, when the fact is that even the most modest estimates show that this is 10 to 30 to potentially even 100 times more deadly than the flu.
New York hospital, for a long period of time, he was giving 10,000, maybe maximum 20,000 masks over a short time, and all of a sudden he's giving 300,000. And I said, no matter how bad this is, could that be possible? He said, no. So there's only a couple of things that could happen. Is it going out the back door? And I've reported it to the city and let the city take a look at it. But when you go from 10,000 masks to 300,000 masks, Mike, over the same period of time, there's something going on. Now,
the president is again implying that the first responders, that the doctors and nurses in hospitals in New York are stealing these masks. He's expressing skepticism that so many masks could be used. New York, at this moment, has over 66,000 cases of the coronavirus. It has, in fact, even gone up in the time that we have been talking. It has gone up to over 66,000 cases, and these masks were designed for single use. So the shortage of masks had been predicted for a long time, and there is no evidence that it is due to doctors and nurses stealing.
300,000 masks, despite the virus and all, you have three. How do you go from 10 to 300,000? And this is very serious stuff. I mean, I could see from 10 to 20 or from 10 to 40 or 50 or something. But how do you go from 10 to 300,000 masks? So what I think you should...
How do you go from 10 to 300,000 masks? How do you go from 0 cases to 66,000 cases? It is the uptick in cases that is causing this shortage. Nurses and other healthcare workers are at high risk of contracting the disease because of the lack of personal protective equipment. Many hospitals and say that the government is not doing enough to limit their exposure. There are about 18 million healthcare workers in the United States. The majority of them are women. Here in New York, we have seen photographs of nurses wearing garbage bags in lieu of protective gear. And this is not because they have been stealing the gear.
Other countries are pretty much shut down, but here we had the greatest economy in the world. We had the greatest economy in the history of our country. And I had to go from doing a great job for 3 years to shutting it down. But you know what? We're going to build it up, and we're going to build it up rapidly. And
all right, the president is talking about the economy again. He is being misleading. He's talking about how quickly it will come back. There is a great likelihood that once this is over, there will be a renewed consumption. But we are also going to have a much larger debt because of the $2 trillion in this spending package. The economy prior to this was strong in many respects, but definitely not the strongest in history. More jobs were created in Obama's last 3 years than in President Trump's first 3 years. And while the stock market hit record highs before the latest drops, it grew at a faster rate under both Obama and Clinton. And adjusting for inflation, real wages have actually been falling in the past several years, which are perhaps the most important indicator of a strong economy.
Please.
Thank you, Mr. President. You've said several times that the United States has ramped up testing. So talk a little quicker or a little louder. Mr. President, you said several times that the United States has ramped up testing, but the United States is still not testing per capita as many people as other countries like South Korea. Why is that, and when do you think that that number will be on par with other countries?
Yeah, well,
and
it's very much on par. Look, per capita, we have areas of country that's very wide. I know South Korea better than anybody. It's a very tight. Do you know how many people are in Seoul? Do you know how big the city of Seoul is? 38 million people. That's bigger than anything we have. 38 million people, all tightly wound together. We have vast farmlands. We have vast areas where they don't have much of a problem. In some cases, they have no problem whatsoever.
The president is deflecting from Yamiche Alcindor's question. She is correct, though. The U.S. is far behind other countries in testing per capita. South Korea was at one point testing 7 times the number of people per capita as the U.S., and I believe the current number is still 4 times the number of people per capita as the U.S.
Because this administration inherited a broken system, a system that was obsolete, a system that didn't work. It was okay for a tiny, small group of people, but once you got beyond that, it didn't work. We have built an incredible system to the fact where we have now done more tests than any other country in the world, and now the technology is really booming. I just spoke to...
The president keeps trying to pin the blame on the previous administration, but he has in fact repeatedly tried to cut the CDC. Even last month, after the World Health Organization had declared the coronavirus a global emergency, President Trump proposed cutting the CDC by 16%. He fired President Obama's Global Health Security Unit from the National Security Council. So he did not inherit a broken system. He inherited a system, and then he broke it.
A snarky question, because I know exactly what you mean by that. You should be saying, congratulations to the men and women who have done this job, who have inherited a broken testing system, and who have made it great. And if you don't say it, I'll say it. I want to congratulate all of the people. You have done a fantastic job. And we will see you all tomorrow. Thank you very much. Thank you. Thank you.
The president ended his briefing by criticizing Yamiche Alcindor, telling her that she had a snarky question and telling her what sorts of questions she ought to be asking. Yesterday, he said that she was behaving in a threatening manner by questioning him. President Trump has obviously a history of attacking journalists, but he has a specific history of attacking women journalists of color, and Yamiche Alcindor in particular. And it appears that this briefing is wrapping up. I'm just checking on one more piece of information. All right. The president has wrapped up his briefing for today, and that is going to conclude what we have to share with you about that. I would like to thank our team here at NowThis. We are working to bring you the best information possible. We are all working from our homes. Most of us are based here in the epicenter of this crisis in New York City. I want to particularly thank Zara Heder, Nico Pitney, and Shelby Vaculin, who have been backing me up with facts throughout this broadcast. Shelby has just given me a very disturbing number. She says that the total number of U.S. deaths from the coronavirus so far is 2,968. That is just 9 short of the number of people who were killed in the U.S. from the 9/11 attacks. So almost certainly, unfortunately, by the end of this day, we are likely to cross that milestone. We are going to continue bringing you the president's briefings, supplemented with facts that the president is not bringing you. I'm Alan Piper, the senior politics producer. Thank you for joining me, and please stay safe. We are all in this together. Stay inside, protect yourselves, protect your loved ones, and let your loved ones know what they mean to you. We're going to get through this, and we at NowThis are going to help keep you informed throughout this. Thank you.